Hi there, I'm Teresa Dufour with your CT Style Express. Many of us suffer from not getting a good night's sleep, but it might be a more serious problem like sleep apnea. Joining us today is the medical director of the Middlesex Health Sleep Disorders Center, Dr. Margaret Wasnicka. Doctor, thank you for making time with us on Zoom.
Thank you, Teresa. It's wonderful being here with you. It's my pleasure to talk to you and the audience about sleep apnea.
Yeah, so first off, give us a definition. What is sleep apnea?
Well, sleep and breathing are definitely underappreciated and definitely not very well known. And we take sleep and breathing at night for granted. So when we sleep, we still have to breathe, and it's automatic. So it's important that everything goes well. So sleep apnea is unfortunately a disease process that affects up to 15% of people in the United States and is usually undiagnosed. So we are just seeing the tip of the iceberg in the rate of a diagnosis. So it's important to diagnose it, and it sometimes presents very subtle and difficult to diagnose it because symptoms may not be very obvious.
Well, let's talk about some of those symptoms. What would somebody experience if they did have sleep apnea?
The most obvious symptoms, of course, are very severe sleepiness and drowsy driving and loud snoring, which disturbs the bed partner, and patients may wake up not feeling refreshed. Mm-hmm. So those are the most obvious symptoms which people may complain about, but there's a whole slew of subtle symptoms which may be attributed to other problems, including nocturia, which is urination at night, waking up with a dry mouth, not feeling refreshed, or feeling fatigued during the daytime, which again may be attributed to other disease processes and actually may represent sleep apnea.
So is there an experience, or at what point does a patient need to seek help?
When you're very sleepy and when you're drowsy driving, and if you have a car accident because of that problem, then I would say you have to seek help. Sure. If you're very tired and unable to function and your work suffers, you also need to seek help.
Sure. And Dr. Wasnicka, what are some of the treatment options?
There's a robust scientific research that has been done over the last 40 years about CPAP, which is a positive airway pressure, which has recently been really shown that improves medical problems if used over other therapies, and it can treat sleep apnea completely, 100% of time.
Wow. Before you get to that stage, are there things you could do that are easier, or that's just the one and only go-to?
Well, sleep apnea is a range of severity, so it can be very mild. It can also be extremely severe, in which case it will lead to hospitalizations and heart problems and neurological problems like strokes. The most common medical problem is high blood pressure and AFib, atrial fibrillation, which is an arrhythmia. So obesity is also something that is a common problem seen in sleep apnea, and weight loss is recommended to improve that before you go on CPAP. Trying to not sleep on your back. Sleeping on your back worsens the obstruction that we see at the level of the tongue. So that improves the severity of sleep apnea. Mm-hmm. Maintenance of nasal passages. So if you're experiencing nasal congestion, if you can improve on that, either medically or surgically, is going to decrease snoring and improve the severity of sleep apnea.
Sure. Well, Dr. Wasnager, we're just hitting the tip of the iceberg here. Of course, you can learn more over at middlesexhealth.org/sleep. We appreciate your time and all the information.
Thank you so much. Thank you for having me.